So now we are going to demonstrate the treatment of leg veins, and the difference between the leg veins and the facial telangiectasia is that we are dealing with larger caliber vessels. So this means that we need a larger spot size for deeper penetration, and we probably need less fluence because the chromophore density is going to be higher. So as we mentioned in the presentation, we are selecting one of three pulse durations, 10, 20 or 30, and here in this case we might need 20 or 30 millisecond pulse duration according to the size of the vessel. If it is large reticular veins, then we might need 30 milliseconds, whereas if you are treating medium veins, then we are going to use 20 milliseconds. The spot size in this case again is going to be 4 millimeter or 6 millimeter spot depending on the size. So if we are dealing with medium vessels, then 4 millimeter will be enough, because if we use the 6 millimeter, the pain associated is going to be too much without additional benefit. If it is large, then we need the 6 millimeter and we have to use proper cooling or more cooling in order to decrease the pain. But as long as we are dealing with medium vein, which is not too deep, then the 4 millimeter will do a good job with much less pain, and this is what we are going to be using. So I'll be using the 1064, of course, 4 millimeter spot size, 20 millisecond, and about 150 joules, and this is going to be almost the same presets on the machine. If you look at the machine, we are going to select again the ND egg and then the veins. When we select the veins, we go for the options. We select red or blue. In this case, it is blue. So it is blue, and then we go for the medium size of the vessels with the R33 handpiece. So it is giving us 20 millisecond, 4 millimeter spot, and 150 joules, and this is exactly what I said that I'm going to use. So everything is okay. When we are using the laser for treating vessels, I don't want to use repetition rate more than 1 hertz. We have to be very slow because this is very high fluence with the ND egg, so we have to be careful. We have to be slow in order not to fire too much pulses on the same spot, otherwise we can have problems. So 1 hertz is going to be enough. And then we are going to be using the cold air cooling along with ice cubes in order to compress the skin, and this will minimize the incidence of bruises. Minimizing the incidence of bruises is very important because this will eliminate the potential risk of hyperpigmentation due to the hemosiderin deposition. If you are able to prevent the bruises from happening, then it means that there will be no hemosiderin deposition into the skin, so we can get rid of this potential risk if we are able to do. Whatever we do, bruises can still happen. Patients should be aware of that, and if this happens, it's going to take about 7 to 10 days to disappear, and we have to let the patient know that after the treatment, they shouldn't stand up for a long time for the coming 3-4 days. Otherwise, the pressure inside the vein will increase and it can reopen after being treated with the laser. So those are precautions which are really very important to be considered. And now we are going to be starting the treatment. So the machine is set. We are using 4 millimeter spot, and we are going to start with this small tiny vein, and we are expecting to see one of two reactions. Either we get vasospasm and disappearance of the vessel, and this is what I would like to see, or we get intravascular thrombosis and coagulation of the blood, and this is another acceptable endpoint. So we pre-cool with the cold air cooling on the vein we would like to treat, and then we start the treatment. First pulse, second pulse, and we can see some reaction. So the first pulse didn't do too much, it is just darkening of the vessel. So I will try to do the second pulse. So still, this is intravascular thrombosis and coagulation of the vessel, which is okay, it is acceptable. However, if we are able to get rid of the vein and achieve vasospasm, this is going to be a better endpoint. So what I'm going to do is to cool the skin with the ice cube, just to compress the skin and cool it a little bit, increase the fluence from 150 up to 160, and then we see the reaction. So I increase the fluence to 160, and we are going to do a couple of more pulses to see what will happen. And we should try to avoid the hair follicles as much as we can. Much better outcome, and I think this is going to be much more effective. And we can see that the vein almost disappeared. So again, some areas disappeared, some areas showed darkening, and this is going to be the endpoint which we can expect in this case. Cooling with ice again will minimize the incidence of bruises. And we can see that the skin is not having any superficial changes. All the